The content herein is for informational purposes only, not intended as medical advice, diagnosis, or treatment, and is not to be substituted for direct advice from your doctor.
Welcome to LymphCast, the gathering place for physicians, healthcare experts, and special guests. We dive into the world of lymphedema, venous disease, and other related disorders, exploring their impact on your daily life. So settle in, unwind, and join us as we uncover everything you need to know about lymphedema and related conditions on our engaging show LymphCast.
Today's LymphCast program is proudly sponsored by VitaSupport MD, the makers of Vein Formula 1000 and Lymphatic Formula 1000. These MPFF-based nutraceuticals are backed by science and recommended by doctors specializing in venous and lymphatic disorders. Visit VitaSupportMD.com to learn more.
Well, greetings and welcome to our LymphCast show. Believe it or not, episode 44 tonight. That's right. Everything is available for you. Every show is on YouTube. Every show is in podcast land, Google Podcast, Apple, Spotify, Castro, Amazon, Audible, you name it. We are out there everywhere. So check out back episodes in case you miss any. And you can also write to the doctors, hello@lymphcastnetwork.com. And while you're at it, visit our website, lymphcastnetwork.com. Everything is there for you, all of the information that you'll need. Well, let's meet the panel tonight from Arizona, Dr. Monica Glavitsky. Hello, Dr. Glavitsky. How are you?
Hello, everybody. It's always such a pleasure to be with my team and with our wonderful guest. Thank you for coming today, joining us, and I'm looking forward to our discussion today.
Absolutely. Let's meet the gentleman who's the founder of this show. He's also the owner and founder of VitaSupport MD. They make Vein Formula 1000, Lymphatic Formula 1000. From New Jersey, physician, surgeon, Dr. John A. Chubak. Hello, Dr. Chubak. How are you?
Hi, Paul. I'm doing great. Great to see everybody. Looking forward to a great discussion.
Absolutely. And let's turn to the CEO of the Chubak Medical Center. She's also the producer of this show, of the LymphCast show. We'll turn the duties over to her to introduce everybody else. But also from New Jersey, as you might have guessed, Dr. Diane Chubak. Hello, Dr. Diane Chubak. How are you?
Hi, Paul. Thank you so much. I'm so happy to be here on this show. 44th episode. Yay. And, you know, we've gotten to this because we have upped our number of episodes that we've been recording, because a little while back we were asked by the authors of this wonderful book, Lymphedema United, You Are Not Alone. And this was compiled by Matt Hazeldine, who is here today from the UK, and Amy Rivera, who won't be joining us tonight, but will be on some subsequent shows. They have put this book together, and what it is a compilation of 30 or so authors from all over the world who have told their story about lymphedema. And, you know, the one thing, you know, I have learned about this, because I'm not a clinician, although I've been running a vein center for 20 years and sort of know all of this stuff tangentially, but lymphedema can come about the etiology is just all over the map. I mean, it can come from so many different places, different ways, whether it be primary, whether it come from some kind of injury or after a surgery. That is the one thing that all the people have in common, that everybody has a completely different story. And so I think it's so wonderful for everyone to listen to these stories and to really learn these things, because, you know, they might recognize some of these situations in themselves. And so education is the name of the game. This is what we're all about in lymphatic diseases, because, as we all know, there is really, truly, you know, a problem with this, but in the community in general, but also in the medical community. So we're here to spread the word. And so these special edition LymphCast shows are, you know, to really honor the people and bring them on the show and let them tell their stories. So I will actually introduce, so Matt, I'm going to have you give a little bit of background of yourself and the book once again, really quick, and then we're going to move on to our guests, Graham and Tom. And so if you would like to just give us a little overview of how you came to do this, Matt, that would be great.
No problem. Thank you, Diane, John, for having me back on the show again. Yes, I was diagnosed with lymphedema in 2011 as a result of surgery in my groin. and had some lymph nodes removed, and a couple of years later got cellulitis, which hospitalized me for 2 weeks. You can edit that one, Paul. And that left me with lymphedema in my left leg. And, you know, for the subsequent years, 3 or 4 years, it was a pretty harrowing time. I buried my head in the sand. I didn't talk. I didn't let people in. I pushed people away. It was quite a life-changing period. And then the turning point came when I decided to turn this negative into a positive and do something productive and proactive to help the lymphedema community. And I think the book that you refer to, You Are Not Alone, epitomizes that period of time where I think the roller coaster is overused in lymphedema, but there's a real downturn after diagnosis. And there are relatable stories throughout the book where people have gone through those tough times, both physically and psychologically, but have seen the light, have come out the other side and have done something amazing and inspirational in the community to help others to live better with lymphedema. And I'm thrilled with the number of fantastic guests that we have in the book. And one of my core objectives when I set up Lymphedema United was to get the male voice heard, because us men tend to keep quiet and hide ourselves under a bushel or bury our head in the sand. And Graham and Tom have worked side by side with my projects from the get-go, and I'm thrilled that they're able to share their stories with you on their podcast this evening.
That's wonderful. And you guys are all in the UK, so it's a little bit late over by you, although I know that you gained another an hour earlier because of our daylight savings time. So it's not too late for you guys. You're not quite in your pajamas yet.
Not this time, no.
Exactly. So yes, and it's wonderful. So I want to actually introduce Graham first. Now, Graham is chapter 10. Graham Rooms. Am I pronouncing that correctly?
Correct.
Now, Graham, in preparation for the show, I mean, generally what we do, we ask all of our guests ahead of time to send us a bio, let us get to know you. And you sent some information it really blew my mind, because it wasn't even necessarily about your bout with lymphedema. It was more what you do or what you've done in your daily life. And it seems as though you are such a leader in your community. You've held so many positions of leadership, of management, and you've done so much philanthropic work, and then these things just sort of dropped on you where you had to make all these changes in your life, yet it seems as though the spirit of Graham still came through because of now dealing with these disorders. I'm going to let you talk about your cancer too. But now you've become like sort of a spokesperson and an advocate for lymphedema. So welcome to the show. And so why don't you start by telling us a little bit about how this all unfolded for you?
Well, thank you so much for that introduction. That is, that's set me up really nicely. Well, where do I start, really? My background, just for everyone's knowledge, was fire service. I worked in the fire service for almost 30 years. And so obviously my health was always of paramount importance. I always kept myself very fit and run 3 London marathons in the last few years of my career. And to be honest with you, the likes of lymphedema and cancer were never in my radar with regards when I was to retire. And literally only a few days after retirement, I was diagnosed with aggressive prostate cancer. And obviously that threw quite a few spanners in the works, to say the least, of where I was planning. But the long and short of all that was that because of my age and aggressive grading of my cancer and also the staging, I quickly was put through surgery, what was robotic surgery. And I remember my consultant telling me at the time that it would leave me with lifelong conditions, such as erectile dysfunction, incontinence to a point, but lymphedema was never mentioned. And it was in my histology report about 6 weeks post-surgery that I noticed some swelling. And I was due to see my consultant at that point. And during that consultation, she revealed to me that my levels of PSA were low, and that was all good. But after an examination, she said, she looked at my mom's pubis area where this slight swelling was, and said, "I think you might have lymphedema." And as I said in my book, you're not alone. In the book, You're Not Alone, I said, "Lymphedema? What's that?" And I really didn't think much more of it. Cancer was obviously my primary concern, and I was referred to the lymphedema team. And it was then that the lymphedema team, which was locally based, thankfully, they measured me up and they said, "Oh yes, I think you've got a little bit of lymphedema. It's not too much. We've got loads of patients that are a lot worse." They measured up me with a pen and all over up my legs and so on and so forth. And it was really very antiquated. And to be honest with you, my lymphedema journey at that point was very much backstage. The cancer was still the prominent concern. But sadly, my surgery didn't work. And sadly, I needed further radiotherapy just a few months later to see whether it could mop up the cancer cells. But during that time, my lymphedema was getting worse. The swelling in my mom's pubis area was getting worse. I had one pair of compression shorts at the time. And what's really interesting, I think, about the particular area that I had it to start with was that every professional I met at that time said that's a really difficult area to compress. Whereas an arm or a leg compression is easier. And every medical professional who was looking at me under the lymphedema spotlight was saying that's difficult because compression in that area where your genitalia is not going to be pleasant and it's difficult. And so really and truly, I sort of then started on this quest to try to find a garment that was going to be successful in the compression. But as my journey of lymphedema started to grow, I started to find a mutation of my lymphedema into my upper thighs, and that became pretty evident when one day I was doing a little bit of DIY and I found this damp spot on my right thigh, and I thought I'd lent against something while I was doing the DIY work, but I realized then that it wasn't the case, and I took my trousers down to find some lymph fluid permeated from my thigh. And it was then really that I freaked out. And I think it was probably the turning point, as I said in the book, that I needed to take this condition really seriously. I thankfully was advised by a very good friend who had lymphedema in her left arm after breast cancer surgery, to find an MLD specialist. And thankfully I did have a specialist close by, and her name was Susan, and she was really quite a font of knowledge in lymphedema, and she was able to guide me and advise me on what I needed to do. And one of those particular pieces of advice, which I still use and I put as a top tip in Matt's book, was about skincare. And this is a bloke, this is a butch firefighter who'd never, ever, ever had used a moisturizing cream on his legs ever in his life. Suddenly being told you need to moisturize your legs and you need to look after your skin as well as you can. And so suddenly the whole world changed to a world where I needed to start to look carefully at what was happening to me. And it was then I was starting to network, and I found a fantastic website of Lymphedema United and started to glean information. I started to do my own research on lymphedema to see what other options there were. And I think probably my biggest challenge, and I think still probably today is still relevant, is trying to find garments that are specifically relevant for men with genital lymphedema that's mutated, potentially migrated into the upper thighs, and trying to get that to. And so I got in touch with a couple of compression garment manufacturers, and I worked alongside them to say, look, if I work with you, can we look towards how you can find a garment that will help me? And that quest was not just 5 minutes, it was quite long. And in the meantime, which I'm sure was probably typical of Matt and Tom as well, I was wearing ladies' compression garments, tights, all sorts of things. And I also purchased loads of different compression garments off the internet that I thought might help me, but actually, quite honestly, I wasted a lot of money on compression garments that were not suitable or fit for purpose. And so, the challenge has been onwards, and my lymphedema is now mutated right down to my knees, but I'm still probably stage 1 of the condition, thankfully. And it was a big decision that I took 2.5 years ago, where I looked at LVA surgery as a potential option. And I visited what was a practice called the Oxford Lymphedema practice, who are probably quite the specialists in this country for lymphedema surgery. And they carried out an MRI scan, they carried out an ICG with regards to see how my lymphatics were working within my legs. And as one of the images that I share within the book again show, it was very stark of the linear pathways that were working perfectly well up to my knees, but above my knees were these starburst and dermal backflow examples. And as Professor Furness had described to me, he said, your lymphatic system is now like a motorway that's had an accident on, where it's struggling and the cars are trying to find an easier route to bypass, going on the A roads or B roads to pass around it. And he said, that's what your lymphatics are trying to do. And it all made perfect sense to me. But the good news to me was that he said, you are actually a candidate for LVA surgery. And so with my backing of my wife, because sadly the NHS doesn't fund that type of surgery in the UK. So it was one of those decisions that I had to privately fund to quite a considerable amount of money. But the way I saw it at that time was, it was about, can I maintain my quality of life? I play golf still, and that's of really importance to me, and not to become a good golfer, but to maintain my mental health. And I think that for me was paramount of importance. And I looked in the mirror and I said to myself, well, as they say, money can't buy you, your health. At the end of the day, it's all about is right for me at the time. And so I took the plunge and I had the LVA surgery. And 2.5 years on from that, I do have a slight increase in my right leg, which is not particularly large, but it's definitely increased in size and volume. But I still believe the gamble or the decision to go for LVA surgery was of most importance. And I guess also my continued quest for compression garments is ongoing. Wearing compressions 24/7 is not pleasant, as we all know. And particularly in that region where if you're working hard or you're sweaty and all that, it just really isn't. So, the compliance issue that you have with regards to rotation of garments, etc., is really difficult. Thankfully, with such wonderful friends and family around me, I continue to strive and move onwards without looking back. And each day is a bonus in both ways, both in the cancer way and the lymphedema way. I know lymphedema won't kill me as such, but as I said already, quality of life, I think for most lymphedema patients, is of paramount importance. And so, what's inspired me to be part of lymphedema and share my story is Matt's inspiring approach to how he shared his story has helped me come forward and share my story, and the likes of Tom also, and so many others that I've met since my lymphedema journey started. So as a brief interlude, and I probably could carry on and on and on, but I'm not going to, because others need to come into play.
Well, I mean, it just goes to show the importance of friends, right? Because not only it's brought you to this network of people. But I think, the friend that you mentioned that actually had the lymphedema in her arm, it seems as though that was truly the person who guided you to, the right people and had you recognize that that's indeed what this was. And so, unfortunately, the fact that you didn't get that from the medical professionals that you were visiting prior to that, is what we're all about here. And this is why we were talking about these things. But also, you talk about like the lack of funding for the surgery. I think you mentioned in your story that they still consider it cosmetic, even though this is a condition that has been brought upon secondarily from cancer. These are all just areas that really, truly need a lot of work. They need a lot of people to advocate and to lobby, about these things. Here in the U.S., the NIH has been pressured by some of our House of Representatives to really create commission, the Lymphatic Disease Commission, just some kind of governing body that is going to be looking at the research on a monthly basis, looking at the funding and the programs that are being created for the people. So it's, there's some work being done. I mean, we still have a long way to go too, but the more stories like yours that we hear, the more that everyone really recognizes this as something truly as a legitimate cause to look into for funding and whatnot. Definitely.
If I may just come back on that, I think the key thing in the NHS in the United Kingdom is that there are what appears to be quite silo working approaches to things. My cancer consultant, all her concern was actually get rid of the cancer, and obviously that was my concern and most primary wish as well. But when I was ultimately referred to my lymphedema team, there seemed to be no joined up working. And what was interesting, and I guess in one way I would have never known, but the 21 lymph nodes that I had taken out were all clear of cancer, which obviously then throws up the discussion about whether the sentinel node, etc., could have been what way of identifying whether cancer had spread or not, or whether even a PET scan could have been carried out prior to the surgery. They are question marks that I've obviously asked since. It's all too late now for me to reverse anything. And as I say, my primary concern is still to be free of cancer, which sadly I'm not. It has become very apparent to me when I've looked closer at the workings of the NHS, is there doesn't seem to be much discussion between lymphedema teams and the consultants of cancer within the UK. And I certainly hope that that's an improvement as we move forward.
Vein Formula 1000 and Lymphatic Formula 1000 from Vita Support MD are backed by science and sold in doctors' offices. If you're a physician who may be interested in prescribing or selling these excellent nutraceuticals, please call 862-246-7877 to speak to a representative today.
I think sadly this is true for all over the world, and especially for, this was a little bit more progressed as far as breast cancer related lymphedema. They did a lot of research, and they have now really very well-established methods to identify and to prevent to some extent the lymphedema. But I suppose that, the work for other type of cancer surgery, it's not that advanced as far as lymphedema concerned. And you are absolutely right. We certainly all need to raise a little bit more awareness about it, because this is certainly an aggression towards the lymphatic system. And of course, you should expect the consequences of it. But I salute you for, immediately taking things in your hands, because to have a friend who helped you maybe to identify, that's one thing. But very often we hear in the patient stories a kind of a time of the non-action, that people are really reluctant to look for a help and to start doing something.
Yes, and also, Graham, you mentioned the compression. Now that's really wonderful that you've taken initiative with that, and you've reached out to the companies making these garments. Is there, where did they leave off with that? Is that something that they are still working on, or is that?
No, they are still working on. Thankfully, one of those garments has now become available on the drug tariff from the NHS. So working with one of the companies, they have been able to push forward that. I did 2 or 3 case studies for them, recommending, and there was some size issues, for example, with regards to garments that I originally trialed for them, around, for example, my hip and my thighs, which potentially put me into 2 different sizes. So they took back, and my feedback provided them with an opportunity to change that sizing structure and strategy, so that it did. I mean, the problem with any garment is that it's never going to be perfect. If it's going to be trying to fit around the hip or the waist and also the thigh, there's going to be so many variants. And in recent times, I've also worked with another company. They've sent me a garment for nighttime compression. And again, similarly, I've given them my feedback on that. Apparently, they will now look at the reiteration of that particular garment to make it slightly longer in a leg, so that it would be fit for purpose, if you like, for, again, patients like myself. And I think the important thing to mention on that is that I'm probably a small percentage within the UK and probably in the world that needs this type of garment. And I guess, it's got to be a case of, demand and how much R&D work they put into these particular garments to get it right. But certainly, if you go online and look at compression garments per se, you will find probably a whole array of garments that will probably be better for a female patient than for a male patient. They do seem to be far fewer models out there, if you like. But it's great to know that these companies are now starting to work with male patients to try to get that, because let's be honest, there's a few bits and bobs that are slightly different with our genders, and obviously that does make a difference. It makes a difference to how comfortable a compression garment is, and as we all know, if a compression garment isn't comfortable, you're not going to wear it 24/7. The simple truth. So whilst compression is certainly not something that any one of us would have chosen if we could have avoided it, if it can be pleasurable to wear as best it can be, whether that's on the golf course or socially or whatever else, then obviously people will become more compliant in wearing a compression garment. I'd like to think that through working with those companies, they are listening to, if you like, the needs and progressing, if you like, their R&D development of compression garments for both male and females.
Mm-hmm. It's almost as if because of the different sizes and different, measurements, it almost has to be like a bespoke type of, garment to be measured for each individual.
Yeah, well, I think I'll jump in there. That's a great point. Well, first of all, Graham, let me just say, first of all, thank you for your service as a first responder all around the world. We all owe our lives and our safety to people like yourself. And I can see how your character led you to such a profession and a life calling, and I see how your character in that way of being someone who put himself in harm's way the risk of his own life for others, how that's being reflected in your journey and your work that you're doing now with Matt and Tom and so many others. Because basically, I would describe your story as I look at it, and I read your chapter. If before anything else, I would call it a story of courage, a story of great courage. When I read your chapter in the opening paragraph, and I think this is important to talk about, as a physician and a surgeon who's dealt with many life-threatening problems in my life, dealt with a lot of cancer surgery in my life as a general surgeon and a thoracic surgeon. In your opening paragraph, I mean, it's really striking. That's why everybody has to get the book and read this book, because these stories are so uncensored and unfiltered and real, coming from the heart. And Graham talks about the fact that he went to a surgeon that discussed with him non-nerve sparing surgery, a sort of a radical prostatectomy kind of an approach, which probably was presented as giving him the best chance for survival and so on and so forth. And he had the courage to choose this very aggressive approach. But he talks about other severe complications that were described to him, including incontinence and erectile dysfunction. And I give you credit for talking about that in the book. That takes great courage. You didn't really have to talk about it, but you did. And then out of left field, really, you were hit with this other complication that had not been discussed. And so that reminds us as physicians and surgeons and caregivers that we have to, in our informed consent, remember to include everything we could possibly think of, because to be surprised with complications is an awful thing. But I give you great credit, and I thank you for your service as a firefighter, as a first responder, and in this fight against lymphedema and for better lymphedema care. I've had a lot of experience in this area as a surgeon over many years taking care of critically ill patients. Lymphedema and edema, acutely and chronically, of the genitalia, especially in male patients, is a major problem in hospitalized patients and patients who are critically ill after pelvic, abdominal surgery, and just from prolonged bed rest, etc. And it is a huge challenge. It's a huge challenge. And we're here to raise awareness and increase the discussion. I'm not sure I'm certain I don't have all the answers. I'm not sure I have any really good answers at this moment, but I have taken care of patients where penile and scrotal edema was extreme, beyond what the layperson's imagination may even be able to envision, fortunately for them. But I've seen it where a scrotum could get the size literally of a small watermelon, larger than a cantaloupe. And that, for anybody to consider it a cosmetic issue, is somebody who obviously hasn't seen that, and certainly someone who hasn't suffered through that. Now, I'm praying that I don't know the details of Graham's extent, but I'm praying he never had to deal with something of that extent. But I saw many patients with that, which can lead to such intense pressure and tension in the skin that it can lead to cellulitis, infection, ulceration, loss of tissue, bleeding, et cetera, et cetera. It can be an extremely difficult, and even in some cases, in the most severe cases, life-threatening, where you can have infection in the scrotal and penile area from massive edema and chronic lymphedema that can lead to an ascending infection that can get up into the pelvic area and into the retroperitoneal space and so forth. And so it's a huge problem. It's a huge problem. And I thank you for your courage in sharing that story. I have so many notes, so many things that we could talk about, which we won't have time for. But again, even if you think about a compression garment for a male who has male genitalia, to compress the the penis and the testicles and the scrotal area, and forgive me, listeners, for being frank in my medical jargon, but I think it's important to talk about exactly what's going on there. Not only can it be uncomfortable, but there are other health-related issues. In a younger patient who was still, let's say, in their quote-unquote reproductive years, and fertility is a question, the function of the scrotum and the testicles is very, very sophisticated, biologically, anatomically, physiologically, so that the distance of the testicles from the core body temperature is a very important thing. So to have a garment that compresses the testicles up against the core body could actually lead to infertility in patients. So there are so many things to consider beyond just discomfort, etc. If you leave a hole in the garment, let's say like a pantyhose with a hole for the private parts to extend out, that could actually create sort of a tourniquet effect around the base of the scrotum and the penis that could lead to a worsening of the edema. So that becomes a huge challenge, just the same way we recommend patients don't wear footless lower extremity compression garments because the foot can swell. So that kind of tourniquet effect is a major issue. I guess there are so many things that I could comment on. It's a long discussion. It's a fascinating discussion, and I'm glad that although it sounds like your cancer is still present to some degree, I'm certainly grateful to God that you are still with us and here and participating. That's a great blessing. And I wonder, I know you had your lymphovenous anastomosis surgery. He was using the term LVA. I want our listeners to know that stands for lymphovenous anastomosis. We had an expert surgeon from the Mayo Clinic on the show with us at one time. If you haven't seen that episode, you should search for that episode. A fascinating operation, a microsurgical operation. What can you advise our listeners in terms of your experience, Graham, with things like elevation, pelvic elevation, with perhaps inversion techniques, and also your experience with lymphatic compression devices, perhaps?
Yeah, well, I'll keep it as brief as I can, but I do have, I tend to elevate my limbs on a nightly basis, just using a compression pillar that's elevated at the bottom of the bed. With regards the compression, I use a multitude of different things to help me each evening, including a simple brush, a bore hair brush, to perform self-lymphatic drainage procedure, deep breathing exercises, and also oscillation machine that I have that I use as part and parcel of my my own self-care process. And I also have acquired a compression suit that I also use, particularly when I've been fairly physically active during the day. And so all of those are combined ways that I've managed my compression. Elevation is undoubtedly a good one, but again, it's all about managing your time properly and making sure you give yourself that time to elevate your limbs as necessary.
Are you using any pneumatic devices, Graham, with a pneumatic compression device?
Yeah, so the pneumatic, the LymphaPress garment is one of those that I've acquired as well, which obviously is this compression suit. This was from my feet up to my midriff area. And as I say, the oscillation machine is the one that I also use, which is a deep oscillation machine. But as I say, the easier ways are simple lymphatic drainage massage that you can perform on yourself to a degree. I still see my MRD therapist every fortnight, who performs those procedures on me as well. So I work in combination with myself. I have quite a ritual at night now. A bedtime routine's very different nowadays than it used to be.
Yeah, I'm sure. I have one other bit of advice that may be helpful for you. One of the things that is a challenge, especially with pelvic and gonadal edema, is that if you elevate the legs, the leg swelling may improve, but you may have fluid collecting in the pelvic area. So one of the things that you could try is sort of it's what we call the reverse Trendelenburg position, and it takes a little bit of doing, but we do that actually for patients who also have severe gastroesophageal reflux disease, but in the opposite direction. You could try putting actually bricks or even cinder blocks under the foot of the bed so that the entire bed is actually slightly tilted. It doesn't have to be extreme, but so that your pelvis were even 4 to 6 inches above the level of your heart. And that your body would still be straight rather than in a kind of L position. Your body would be flat, but tilted with your head down, slightly down. You don't want your head too far down. But if it's a slight elevation of the foot of the bed, that can really help to take fluid out of the legs and the pelvis back into the general circulation, back to the heart, etc. And with people with gastroesophageal reflux disease, GERD, we do the opposite, put bricks or even cinder blocks under the head of the bed so that they're not tilted, but they're at an upward incline so that stomach contents don't come back up into the esophagus. So just another tip. There's just so much to talk about. But I think fortunately we're going to have to move on to Tom's story as we're going way into the wee hours of the night. So
well,
do you want to introduce Tom?
Yes, I would love to. And but Graham, thank you so much for sharing everything with us. We really appreciate your courage. And yes, to switch gears, I would like to introduce Tom Neilson. And Tom, you are chapter 26 in the book. And now, wholly different scenario, right? In terms of how this came about, how lymphedema came about for you, and how unusual, statistically it actually is. Why don't you tell us a little bit about yourself and your journey?
Sure, absolutely. Well, firstly, thank you for having me on. I'm really excited to be a part of this. But sort of as for my journey, I'm about just coming up to my 5th year with lymphedema. It was April 2019. I first noticed the swelling in the bottom of my left leg. And, obviously being a fella in his early 30s, it was a little bit perplexing as to why this was happening. But, I managed to get an appointment with a doctor that day. And they just, to be honest, they were just thinking, I guess, the worst, as they tend to think. So they thought I might have had a DVT, deep vein thrombosis. So they sent me off to the hospital to get that checked out. And thankfully that turned out to all be okay. And I was sent away with some sort of blood thinners as a precaution. And to be honest, I thought that might have been the end of it. It just seemed sometimes you just get those freak things that happen, and I didn't really think much more of it. But as time went on, it soon became apparent this swelling was sort of sorting itself out overnight, as it tends to do in the early days, and it would just reappear later on. So I ended up going back to the doctor multiple times over the course of the year, trying to get a sort of resolution as to what this was. And they seem a little bit perplexed as to why it was happening. And I think it links into what Matt has spoken about before, and Graham, that sort of on the ground where you're dealing with doctors and GPs, they don't necessarily know about lymphedema, or they're not really aware of it at all. So it ends up just being quite a prolonged battle to get focused on that condition, and knowing the ways you can deal with it. So as time went on, I think I ended up pressing on. I did my own research, and I was pretty certain this is what I had. And I returned to the doctor again with all the knowledge, sort of almost like a presentation. I knew this is what it was, and to get a referral to a vascular specialist to, accelerate and get a diagnosis. that did take a bit of time with a couple of delays, and thankfully I managed to see someone just before COVID really started in early 2020. I'm really glad I did, because as everyone knows, sort of hospitals and it all became a no-go zone really for sort of non-essential things like that. So at that point, I was really happy I got the diagnosis. But I really remember the day he told me that it was lymphedema, and it was almost like a passing comment almost that, yeah, you have it, and here's some compression garments to go away with, just off the shelf, and that's it. And not really a lot more knowledge other than that. And it's, at the time you think, well, okay, lymphedema, sure. If he's pretty chilled about it, then I guess I can be. But, as time went on, it soon became apparent this was going to need a lot more attention. And thankfully, in the area I'm in, we do have quite a good lymphedema clinic, good staff, and I feel very fortunate to have that, because in the UK especially, it can be a bit of a lottery depending on where you live, whether you get an appropriate amount of care, really. So thankfully, since then, under the care of that clinic, I'm very happy about how I'm being treated. I've had courses of decongestive lymphatic therapy. It's things I'd like to repeat, really, to sort of keep my condition under control. But as you were saying, Diane, it's sort of a rare thing for me that, in terms of being a younger sort of generation, and more importantly being male, it's quite rare, and especially being a primary lymphedema as well. And that's something I've not really come across, often. And it's good to be able to share the story with people and be quite a voice for people who might not necessarily have one. And that sort of leads me to doing what I'm doing now, which is, I'm nowhere near as active in the community as, say, Matt is, but I do run a Facebook group for lymphedema sufferers in the UK. I didn't create the group. It was created by a lady called Penny, who took a back seat to the running of the group for various reasons and left it to me to be able to control. But, we have a membership now of over 4,000. We have a sort of around 100 posts a month. It's a very active group, and it's incredibly supportive for people who are just looking for answers that they might not get in the usual sources that they want. But going back to my point before, the group of over 4,000, there's only about 7% who are men. So when you put it into when you put it into figures like that, you realize that it's quite the split, really, when you think, especially if you're a male voice in the community looking for someone who's in a similar position, it's going to be quite a tough find, really, unless you're looking in the right places. So I guess from my perspective, all I can try and do is just, be as active as I can in the community aside my day-to-day life. And that includes, when Matt reached out to me to discuss doing all sorts of things in the community, whether it was meetups or promoting his website and contributing to his book, I was absolutely more than happy to. And if it includes, talking on a fantastic show like this to help raise awareness, I'm more than happy to. So yeah, that's my story, I guess.
At VitaSupport MD, we believe in creating the best bioflavonoid-based supplements to support your vitality. Bioflavonoids are found in abundance in nature and support excellent health and wellness. The demands and stresses being put on our bodies in these challenging times are unlike any we have seen before. Support your body with the flavonoids it needs to fight inflammation and oxidation. Unlike other products in the marketplace, VitaSupport MD dietary supplements use micronized flavonoids for optimal absorption and effectiveness. Micronization is an advanced process which creates an ultra-fine powder easily absorbed by the body. At VitaSupport MD, we are passionate about making your good health our life's work.
That's absolutely wonderful. And I've just the story, even the way you described in the book about how when you were just told almost, nonchalantly, you have lymphedema, go ahead and, take a compression stocking with you.
Yeah.
And, like you said, almost as if someone just was telling you had the flu. And now to this point, to this day, and all the evolution and the history of this that you've gone through, and what you've learned, that you now are, this sort of rare male voice for this. I was looking up some statistics about the incidence of primary lymphedema, and I don't know, Monica and John, you can probably, let us know more about this, but especially primary lymphedema that kind of strikes, well into someone's life, like yourself, Tom, in the 30s. But it seems as though like one in 100,000 women will get it, but 1 in 400,000 men. So that's sort of your ratio with that. So it's a rare thing, and that explains that ratio of people coming to your Facebook. But it's definitely, I mean, thank goodness for the digital age, right? I mean, there's a lot of pros and cons to social media, but in situations like this, your Facebook page is giving someone, a lot of help and support, and, oh, this is what's going on with me, because their GP, they're not defining it or diagnosing it for them. So that's wonderful.
Yeah, I was going to jump in there. Oh, go ahead, Monica. No, you go ahead.
I think that most importantly, they are not aware of what does it mean. Simply, they most of the physicians are not well trained as far as lymphedema prognosis, treatment, or whatsoever. How many hours we have on lymphedema? Practically, close to zero in our medical training. So it's a huge issue to fight. I think more and more efficiently to introduce it to the medical training, because that's why, this is happening. People are thinking DVT, of course, swelling in one leg, DVT, up, done. But they are not even imagining that a guy in his 30s can have the primary lymphedema. That's not crossing.
Well, I was going to say a few comments. I agree with Monica completely that at the root of much of this is ignorance, ignorance and poor training. But it's more complicated than that in some ways, because even when there is not ignorance, even when you have understanding, then we see a lot of what I keep calling on our program dismissal. The patients are almost immediately dismissed. You say, oh yeah, well, you have, Graham, Tom, you have lymphedema. So, you need to get some stockings, get some compression, and, I wish you the best. That's it. Because it's not that physicians don't care, but certainly some things are easier to care for and care about than others. The problem with lymphedema is it tends to be chronic, progressive, and incurable. So especially if you have the bad fortune of running into a surgeon, surgeons hate these kinds of problems. Surgeons like to be heroes, right? Nobody wants to be a firefighter and fight the same fire for the rest of their career, right? You want to either have the building burn to the ground or put the fire out and save the cat and the kids. So surgeons like to fix things. Appendix, that's a great operation. You only have one, it doesn't grow back. You take it out, you save the patient's life, you're a hero. Same thing with a gallbladder. You have one, you take it out, it doesn't grow back. So surgeons are very, very dismissive of these kinds of things, generally speaking, because this is a long timeline. This is a long haul battle. This is not something that can be surgically corrected, generally speaking, quickly or easily. Internal medicine doctors, internists, primary care doctors, etc., they're so busy taking care of thousands of patients with blood pressure and diabetes and high cholesterol and things like that, and sadly, in the state of healthcare around the world today, and in the quote unquote developed world, the UK and the States and Europe and other places, we have so much good pharmacotherapy for things. Medicine has been reduced to writing a quick prescription and on to the next patient. Here's your Lipitor, here's your Crestor, here's your insulin, here's your whatever it is, beta blocker, and we take care of the big three things: blood pressure, blood sugar, and cholesterol, all day long, every day. Now you come with a problem that I don't have, a great prescription for. I can't get you out of my hair in 5 minutes. It's a problem. So the surgeon doesn't love you, and the internist doesn't love you. So you fall in this place between those two big worlds. Then who's going to take care of you? That's when you hope you find really a subspecialist, somebody who has come into the field of lymphology one way or the other, like our dear Dr. Eicher, who unfortunately couldn't be here today, who had her own story with lymphedema and her own health problems that led to her interest in lymphedema as a physical therapy and rehabilitation medicine doctor, an MD. Or you might find yourself with physical therapists, occupational therapists who are certified lymphedema therapists. And in many cases, that may be your best place in today's modern world of therapy. Those are the people who are interested, dedicated, caring about that, knowledgeable in that field, and have set up their practice and their clinic and so forth to do that. And the other problem is, quite frankly, in the United States, where it's more of a fee-for-service situation and not a completely socialized system. We don't have an NHS as you do in UK, but we do have Medicare for people, generally for people over 65. The reimbursement for taking care of patients with these problems is pitifully low. So, when you're talking about a few dollars, literally a few dollars for spending time with the patient, spending 30-minute, 50-minute and so forth in consultation or in manual drainage therapies or wrapping, etc., it's not economically feasible. So that's another massive stumbling block. And Diane referred earlier to the Lymphedema Therapy Act, which is now passed in the US and brand new, and we're learning about it, experimenting in terms of reimbursement for compression garments and so forth. But that's going to be very, very limited, because in a nation of 350 million people, you can imagine how many billions and billions and billions will be spent on compression garments like that if it sort of opens the floodgates. So it's the reason we have the program. It's the reason that, we come on here every week. It's the reason that we were so enthralled by Matt and Amy's idea to review real life stories of real patients dealing with these problems and bring awareness. If we don't have all the answers, the one thing that we can do is raise awareness, put it in front of more people, more eyes, more ears, more lawmakers, more doctors, more therapists, more patients, more family members. And the more noise that we make, the more attention we'll get, and hopefully the more answers will come, and there'll be more interest in research and so on and so forth. So it remains a big challenge for us. And the one other thing I wanted to say to Tom, please never make the mistake of discrediting your contribution or minimizing your contribution. You're here tonight, right? Mm-hmm. You're up late, right? Talking to us from across the Atlantic Ocean, and you've made that effort. You're in a Facebook group, you may not have started it, but you're participating, and you have 4,000 people involved. Now, when Diane talks about the numbers, 1 in 400,000 men, 4,000 people makes up a lot of the men with that problem, I would think, mm-hmm. because that's a very rare disease. That's a rare problem. So please don't discredit your contribution or minimize or disparage your contribution, because everything counts. And no matter how big or small, everything that you do to move the boat a little faster and to make your contribution, everything counts. Everything that we're all doing together counts. I think it's been an amazing program. I always learn a lot. And I think it raises the awareness again that it's not just a female disease. Certainly, it's a disease that affects men and women. It affects young and old. Oh, and the other one, last thing I wanted to say, in our 44 episodes and in the discussion of the patients from Lymphedema United, the best part of the book, Matt, is the subtitle, which it often is in books. You're not alone, right? You're not alone. None of you are alone. And everyone, this is a disease that can come from so many different directions to meet at the same endpoint, which is lymphedema, whether it's post-traumatic, whether it's congenital, whether it's primary, secondary, post-surgical. Sometimes it's a cloud of silver lining. Somebody's been cured of cancer, but winds up with a massively swollen limb, etc. It is a physical disease. It's an anatomical disease. But as I keep saying, it's a psychological disease. It's an emotional disease. It's a disease that affects every aspect of the human condition: intimacy, sexuality, self-confidence, self-esteem, self-image. This is a really, really, really important fight that we're all in, and we're not going to give up until things get better and better and better. I don't know if we'll ever find a cure, but we're not going to quit until that day comes.
Can I have a last question? Because that's for sure. We have here wonderful example. Different stories, different origin, and different situation. But especially for you, Tom, I was asking myself, how are you managing the taking care of the disease? And being a young man, you have to work, right? You have to manage your professional life. How does it work for you?
That's quite a good question. I think it's funny because now that I'm nearly 5 years into this, you almost, like Graham and Matt will sympathize, you allocate time in the day now, and the further you go into this, you don't even notice it anymore. But if you explained it to someone who doesn't have this condition, that you think, that's occupying, maybe an hour or two of your day, combined either side. And it's not just that, it's because it's affecting every thought you have. And I always said this, that whatever activity you're doing or, participating in, you're thinking, oh, how is this going to affect my lymphedema effectively. But as for me day to day, I think compared to some people, I feel like I get off pretty lightly, to be honest. I can just wear my compression and it generally behaves itself. I do have a home compression system, which I use, which is sort of used to replicate the MLD therapy. And I try and use that twice a day usually. But and each session for that is about 35 minutes. So, before you're talking well over an hour before you even, done anything else in the day. And yeah, I think I'm quite fortunate. But when I think of going back to the sort of early diagnosis question, I think that's what I found more frustrating, is because you realize just how vital those early days were to bring this condition under control. And I think that's what a lot of people would just love to have, that they can live with having the disease itself. But if they had this fountain of knowledge to begin with, and the early diagnosis and, the access to everything they needed to bring it under control, it wouldn't be dominating their life as much as it is. And I feel very fortunate that I'm not in that boat. And I know I'll have to make adjustments every single day for it. But I think I'm quite fortunate to be effectively getting off as lightly as I do, compared to some of the stories I see shared on the group and the people who have no kind of treatment whatsoever, or they're really fighting for it. So, I think that's why it's up to, everyone here in the community to keep raising awareness for it. But that's it.
And I think, Tom, also the kind of the final thought you leave us with in your chapter is, there's this thing, it's called your life, right? And as much
Yeah.
as these thoughts preoccupy you, and you learn to integrate them into your normal life and thoughts, but don't let go of your life. Do find a way to do the things that you love. I mean, you mentioned that you and your partner love to venture out and visit castles and cathedrals, and these are the things that give you joy. And obviously you are a lover of history and, obviously traveling. So, however that can work for you, just fight for that.
Absolutely. Yeah, completely agree. The way to go. And I would just like to say that stat you threw out earlier about 1 in 400,000, I'd not actually heard that before. So that's kind of blew my mind a little, to be honest. I'd not actually heard that stat before. So I guess I am quite a rare case, so I'll take that.
Yeah, and I would comment on that only to say that I wouldn't be surprised if that number isn't wrong, only because there is so much underdiagnosis, misdiagnosis, and dismissal of this problem. It's still going to be quite rare, of course, very rare, but it's likely to be a lot more than that. And I'm famous for saying I'll say one last thing, but I'll say one last thing, which is, many times friends of mine or family members who are not in the medical field will say, hey, doc, when are we going to have a cure for cancer? Like, when are they going to finally cure cancer with all this technology and so forth? And one of the things that I explain to people is that it's not so simple, because it's not one disease. It's hundreds of diseases. Lymphoma is different than leukemia, which is different than non-small cell lung cancer, which is different than small cell lung cancer, and on and on and on and on. And each one of those problems needs its own treatment and its own solution. And little by little, we are figuring it out. And with enough time, human beings will figure out the answer to all those problems. It won't happen in my lifetime, I'm sure, but in maybe many lifetimes, with all of the brilliant scientists working on these things, those things will be figured out and taken apart and corrected. Lymphedema, I think, is very much the same way. It says, oh, I have lymphedema. But if you have 1,000 patients with lymphedema, you probably have 700 different background stories as how they got to this swollen part of the body. And so Tom's treatment is going to be grossly different than Graham's treatment, which is going to be significantly different from Matt's treatment and Amy's treatment and so forth. Somebody may benefit from LVA, somebody may not. Somebody may benefit from the kind of dramatic surgery we saw Dr. Harken Brorson from Sweden present on our show. If you all haven't seen that program, or our listeners, you have to see the program with Dr. Harken Brorson from Sweden and the dramatic surgery he's doing with liposuction. But again, I'm sure he'd be the first to say that not every lymphedema patient is a candidate for that. So every patient has to be treated as a unique case, as an individual, obviously as a human being. And dismissal from the medical community because you don't have a life-threatening problem, generally speaking, that you're going to die from anytime soon or ever, is not a reason to put people to the side and to neglect them. And again, that's why we're here, to raise awareness. With that, Paul, I think you might want to wrap it up for us this evening. It's been amazing.
Absolutely. Another terrific and highly fulfilling episode. You've been watching and or listening to the LymphCast show, episode 44 tonight. Remember to visit our website, lymphcastnetwork.com. If you have a question for somebody on the panel, use our email address. It's hello@lymphcastnetwork.com. That's on the website when you go there. Every episode is on YouTube, and every episode is on your favorite podcast platform. Just go there, Apple, Google, Spotify, TuneIn, Stitcher, Castro, you name it, we're out there. Just type in LymphCast and this show will come up. Let's go around the room and thank everybody for being here tonight. Dr. Diane Schubeck, let me give it to you first, if you don't mind, and thank our guests, and then I'll thank our regular panel, and we'll take it home.
Yes, I'd like to thank everybody. I think we had a very, very wonderful discussion, brought up a lot of topics we, haven't necessarily spoken about before. And I'd like to give Matt a second just to tell us, where we can find the book and a little bit about his website.
Oh, thank you, Diane. So the book, the quickest way is to jump on my website, which is lymphedemaunited.com/books. and it is available on Amazon and around all good online booksellers, but the quickest way is to jump on the website and order it there. Let me take this opportunity, if I may, to thank Tom, to thank Graham for their courage, which is a great word John used earlier, in sharing their story. It's an absolute pleasure knowing these fellas and working side by side to do our little bit to raise awareness and help others to live better with lymphedema. And I know that's a corny plug for my other book, but it's so true. That's what we're here for, to help others to live better with lymphedema. So thank you for having us again, Diane.
It's my pleasure. And thank you, everybody, for being here tonight.
All right. Thank you very much, Diane. Let me go around the room. And from Arizona, Dr. Monica Glavitsky, regular panelist. Thank you, Dr. Glavitsky, for everything tonight.
It's my pleasure, of course. And thank you, Matt. Thank you, Graham. Thank you, Tom, for being with us. And well, to all our audience, see you next time.
All right. Thank you, Monica. The CEO of the Chuback Medical Group. She's also the producer of this show. Every single episode, she's the producer. Dr. Diane Chuback. Thank you, Diane, for everything.
Thank you so much. It's been a lot of fun being on the side of the camera for these special edition shows. So thanks for having me on.
Absolutely. I won't ask how many hours a week you put in because I'd be afraid of hearing the answer. So we'll just let that go. It's probably a couple thousand a week. So.
Well, we're using some technology to automate some things, and it's growing.
All right. Well, thank you for everything. And the gentleman who started this show, the founder of this, he's also the founder and owner of Vita Support MD. They make Vein Formula 1000 and Lymphatic Formula 1000 from New Jersey. Physician, surgeon, Dr. John A. Chuback. Thank you, John, for everything.
Thank you, Paul, and thank all of the guests tonight and the panelists. As always, an inspiring and motivational program tells us that with all the good work being done, there's more to be done, more to learn, and more to do. And I encourage everybody here to help each other out on social media through our LinkedIn accounts, the Facebook pages, the Instagrams, and for our listeners, do the same. Look for us on LinkedIn, etc. Follow the accounts. The more that we help each other, a rising tide lifts all boats. So I think that the more that we do to kind of interconnect and reach out to each other, I know Matt and I do a lot of that through LinkedIn and some other places. Everybody benefits from that. The louder our voice, the more likely we'll be heard. And there's strength in numbers for sure. All
right. Thank you very much, Dr. Chuback. We want to thank everybody for listening and or watching tonight. This has been a LymphCast, episode 44. We'll see you next time for episode 45 of your LymphCast show. Go out there and have a great night. We'll see you next time.